Hello, I'm McFerran, Managing Director of Allstate Northern Ireland and Chair of Business in the Community's Business Action on Health campaign. In today's message, I'd like to talk to you about three workplace issues: the business imperative for employee health and well-being, the impact of stress and poor mental health at work, and how we can all work together in planning for a global pandemic. Let's start with health and well-being. In a year of unprecedented economic and business challenges, business leaders are increasingly recognising that health and well-being is now a business imperative. At Allstate, we take a proactive approach to improve the health and well-being of our employees. Doing so and being known for investing in our employees' health, well-being, learning and development helps us recruit and retain the best employees. One particular initiative we have used to great effect is our working pattern choices. This enables our employees to choose a number of different flexible working patterns. For example, condensed working weeks, tailored part-time working, home working, flexible start and finish times, duvet days, term time working, career breaks, and these are just some examples. The company has benefited through dramatically reduced absenteeism, much higher employee loyalty and retention, and the consequent savings in recruitment and training costs. We estimate that we save over £500,000 per annum as a result of these arrangements, and probably a lot more than that in the intangible feel-good benefits. The Business Action on Health campaign provides practical guidance in developing, managing, measuring and reporting on employee health and well-being. Using tools developed by Business in the Community, including an online wellness assessment, employees can assess their physical and mental fitness and receive immediate guidance on how to improve their well-being and lifestyle choices. In turn, employers get the opportunity to benchmark the health issues in their workforce against a set of national standards, including health and safety executive stress management standards. This equips organisations to choose where best to target resources for highest impact. Already over 60 organisations in Northern Ireland are now proactively engaged with the campaign, and they're starting to show positive results in their own workforce, which will ultimately make a noticeable difference in our overall national health. We are all very familiar with the term absenteeism. Although difficult to calculate, the estimated cost of absenteeism to business is around £650 annually per employee. Surprisingly, absenteeism as a result of ill health is no longer viewed as the greatest cost to business. On the other hand, the greater threat is when employees come to work but function below par because of ill health. This issue is now defined as presenteeism. The average cost of presenteeism is considerably higher than absenteeism, at £145 per employee per day. It's estimated that businesses in the UK lose £15 billion in lost productivity each year due to staff working below par because of mental ill health. This includes common conditions such as depression and anxiety, as well as more serious diagnoses. If employers take mental health seriously, they will have a workforce that's healthier, happier and more loyal, with less than 1/5 of mental ill health problems directly associated with working conditions. Focusing your resources to tackle this issue will yield the highest return on investment for the business. The message is work is good for mental health, not bad for mental health. Within Allstate, we have developed a very successful return to work rehabilitation programme that provides both work interventions and any reasonable adjustments to the workplace, which has enabled us to expedite returns to work with the obvious business benefits. So what about swine flu? Swine flu has dominated the headlines throughout the summer months. We have been bombarded with information and misinformation on the subject, probably resulting in general confusion. In all my years in business, I've never experienced anything like this, and with the kids back at school and the onset of colder weather, the situation looks set to worsen. It has made me question how our business deals with the threat of pandemic in whatever form it may take. Business in the Community has been working hard to develop an easy guide for businesses, helping them implement a simple 5-step plan to deal with any eventualities that might arise as a result of a global pandemic. I'm delighted to say that this publication is freely available for download from the Business and the Community's website, and you'll also find a link in this e-zine. Finally, I'd like to wish you every success in the coming months and years as we work together to make Northern Ireland's workforce healthier and happier.